Hello, this is Drake, Student College of Clinical Pharmacy's clinical update on the Hepatitis C treatment guideline, which is published jointly by the American Association for the Study of Liver Diseases and the Infectious Diseases Society of America, and was published in January 2014. This has been a living document since it was originally published, and it still receives multiple updates a week. Our objectives for this talk are to give a quick background on hepatitis C virus, or HCV, outline some important information pharmacists should know about both older and newer HCV drugs, and provide an overview of the current HCV treatment recommendations. Put simply, HCV is a virus that infects the liver, causing inflammation, which can be severe. It's estimated to infect approximately 3.2 million Americans. Its most commonly cited means of transference is through use of contaminated needles. The majority of these cases are attributed to the very high HCV infection rate in the 1980s, which was about 200,000 cases per year. Of the patients infected, about 75 to 85% develop long-lasting infection, and the total healthcare cost of the HCV infections from 2010 to 2019 is projected to exceed $10 billion in the United States. Treatment of HCV should be guided by genetic testing of the virus whenever possible. 75% of patients with HCV have genotype 1, while the majority of the remainder have genotype 2 or 3. Genotype 1A specifically is known to have high potential for resistance, making it the most difficult to treat. It's important that patients undergo treatment for the full recommended length to fully eradicate the virus. Regarding the drugs themselves, sofosbuvir is a new drug approved in the United States in 2013 under the brand name Sovaldi. It's a polymerase inhibitor, which means it prevents HCV from replicating its genetic code in host cells. Common side effects of sofosbuvir include headache, diarrhea, insomnia, anemia, and fatigue. Patients should be monitored for signs of HCV infection improvement using various laboratory values, which includes the amount of virus detectable in the blood, also known as the viral load. It's important to note that all patients receiving treatment for HCV should receive a pregnancy test, as some of the drugs used commonly are prone to causing birth defects. Sofosbuvir is dosed at 400 milligrams orally once daily. Cimeprevir is also a new drug approved in the United States in 2013 under the brand name Alecia. This drug is a protease inhibitor. The virus is able to replicate its genetic material, but is unable to produce useful proteins from it. Common side effects include rash, itching, nausea, increased bilirubin in the blood, and an increased sensitivity to light and sunburn. In addition to monitoring for signs of infection improvement and for pregnancy, patients should be tested to see if the virus they are infected with has the NS3Q80K mutation. This is the mutation believed to cause the virus to be resistant to treatment with this medication. Cimeprevir is also given orally at 150 milligrams daily. Boceprevir is the last of these new HCV drugs currently available on the market. It was approved in 2011 under the brand name Victrellis. Boceprevir is also a protease inhibitor. Common side effects to watch for include pancytopenia, which is low counts of all blood cell types, or anemia, diarrhea, and fatigue. Patients should again be monitored for improvement of their infection and for pregnancy, as well as receiving routine blood, electrolyte, liver function, and thyroid tests. This drug has a more frequent dosing schedule at 800 milligrams orally 3 times daily. Ribavirin is one of the first drugs approved for treating HCV. It was first approved in 1985 under the brand name Virazole. Ribavirin is a nucleoside analog. It becomes incorporated in the genetic code of viruses, which can cause mistakes in genetic replication as well as prevent the replication process itself. Common side effects include anemia, TTP, which is a blood disorder, liver damage, nausea, vomiting, and diarrhea. Note that this drug can cause liver damage, and patients must therefore be monitored carefully for liver function, as well as receive regular eye exams and blood, thyroid, and cardiac testing. Again, monitor for disease improvement and pregnancy. Ribavirin is specifically known to cause birth defects and is pregnancy category X. The dosing with ribavirin is a little more complicated and depends on the patient's weight and the genotype of their virus. Finally, interferon is also an older drug approved under the brand name Pegasus in 2002. Interferon has a complicated mechanism of action. Essentially, it helps the immune system fight the infection by binding to infected cells. There are many side effects of using interferon. However, it's very important to note that many patients experience suicidal thoughts while on this drug, as well as flu-like symptoms including nausea, vomiting, fever, chills, muscle aches, and headache, and fatigue is also very common. Patients need to be monitored for disease improvement, various blood, thyroid, electrolyte, and liver tests, and signs of serious side effects like serious fatigue, severe rash, and infections. Interferon comes in multiple formulations. Pegylated interferons or PEG interferons are almost always used because they only require once weekly injections and are more effective than non-PEG interferon. The dose is initially based on the type of PEG interferon and the patient's weight, but can change depending on how well it works and how well the patient tolerates it. Clinicians need to make sure patients are eligible to receive interferon before giving it. These are some highlights from the slide. Since interferon increases immune system activity, it would worsen the disease state of a patient with an autoimmune disease. Patients with decompensated hepatitis, which is a severe and advanced form of the disease, shouldn't get interferon. And since interferon is so prone to causing suicidal thoughts, it shouldn't be given to patients with uncontrolled depression. The treatment recommendations can be a little complicated, so we'll let you read through the more specific information on the slide. These are some important points. Pharmacists should know that different drug combinations are recommended for different genotypes, nearly all of which contain ribavirin and sofosbuvir. Treatment should last at least 12 weeks, but duration will vary depending upon genotype, the drugs being used, and response. Remember that 75% of patients have genotype 1 virus, which is usually treated with interferon. This means that it's very important that pharmacists remember to screen for interferon eligibility to avoid giving it to a patient for whom it could be very dangerous. One very important practicality that pharmacists can have an important impact on is the pill burden associated with these therapies. Ribavirin therapy is usually 5 or 6 tablets or capsules a day, and boceprevir is usually 12 tablets a day. One of the biggest advantages then of sofosbuvir and cimeprevir is that they are once daily. The new guideline can be found very easily at hcvguidelines.org. This website is very useful for brushing up on treatment specifics. We'll end this update with a few words about the guideline from Dr. Kelly Percival, Drake's new Assistant Professor of Pharmacy Practice in Infectious Disease.
Thank you for the opportunity to speak about the new Hep C guidelines. So as you heard in this presentation, this is an exciting time with rapid changes in how we're treating Hep C virus. And treatment options are achieving a higher rate of sustained viral response, especially in type 1, which has historically been very hard to treat, as well as allowing for shorter treatment durations and eliminating the need for PEG interferon in genotype 2 and 3, which has numerous side effects and can be very hard for patients to tolerate. So this change really started with the development and approval of the direct-acting antiviral agents in 2011. With the two initial direct-acting agents approved being boceprevir and telaprevir, which telaprevir was not talked about in this presentation because it's already been removed from the market due to no longer being recommended in the most recent guidelines. So the current guidelines recommend using direct-acting agents sofosbuvir or samiprovir, which are the second wave of agents which were approved in 2013. Sofosbuvir, a polymerase inhibitor, can be used in all genotypes, unlike the protease inhibitors, which includes samiprovir and boceprevir, which can only be used in genotype 1. And the other advantage to sofosbuvir is that it can allow for a PEG interferon-free regimen for genotypes 2 and 3. And one thing to be conscious of, though, is that in genotype 3, it does require a longer treatment duration than genotype 2. And this is something that has changed with these new drugs and updated guidelines, as we used to think of genotypes 2 and 3 being treated in the same manner. With a 1-pill once-a-day direct-acting antiviral agent plus ribavirin and PEG interferon regimen, in genotype 1, there's been a significant decrease in the daily pill burden from 18 pills per day with boceprevir plus ribavirin to 7 pills per day now with sofosbuvir or samiprovir plus ribavirin. For type 1, the amount of patients achieving a sustained viral response has increased significantly, from the original regimen of PEG interferon plus ribavirin having about a 40 to 50% success rate to a 90% success rate with sofosbuvir plus ribavirin and PEG interferon. There are numerous more drugs expected to be approved over the next few years, hopefully some as early as late 2014 or early 2015, that will continue to revolutionize how hepatitis C is treated and hopefully will remove the need for pegylated interferon in genotype 1 patients and continue to further decrease the pill burden. While the development and approval of these new agents is exciting, it comes with a very large price tag attached. The cost for sofosbuvir is $1,200 per pill, leaving the average cost of a treatment course to be around $100,000 just for this single agent. Samiprovir comes at a slightly cheaper price at around $85,000 per treatment course. And this has led to some difficulty and delay in the start of therapy for patients, depending on if their insurance company will cover it or is willing to pay, and for these newer hepatitis C treatment agents. In conclusion, be expected to see approval of more agents for the treatment of hepatitis C virus in the relatively near future and continued updates in the hepatitis C treatment guidelines.
Thank you very much, Dr. Percival, for providing us with more clinical information on the HCV guidelines. And thank you to our listeners for listening to this presentation.